Hello and welcome to Reach Live. We are at the halfway mark of 2022. How did that happen? I'm Rena Such. I'm the head of digital and connected health at Ipsos. Ipsos are a global market research and insight agency. And I'm also one of the presenters and partners of Reach. Reach is a non for profit platform driving forward the voice of digital health with a huge clinician network. And they're doing some fantastic work, particularly in maternal health. So I urge you to subscribe and check out the resources that you have access to and check out what Reach are up to. And for me, Reach Live is without a doubt one of my favorite days of the month because last Friday of every month, I get to meet an incredible individual and have a conversation. And today is no different. So, Dr. Yuli, who's here with me today, has an incredible career. I can't wait to talk to him and introduce him to you all. I work with clinicians every day. The research that we do at Ipsos is about talking to doctors. And often I'll talk to doctors of many different varieties. And today we have an innovator with us, an individual who has carved a career and really understood the power of technology and is doing something about it, which I love. So, Yuli, welcome. Welcome to Reach Live.
Thank you, Rena. It's a pleasure to be here. This is exciting. Thank
Yes,
you.
fantastic to have you. And we didn't even coordinate. We just wore blazers because we knew this was going to be a great chat. So, Yuli, please kick off with an intro. Let the individuals who are here know a bit about you. How did you start in healthcare and how did you become interested in technology?
Sure. Um, my background is in emergency medicine and epidemiology, which is population health. And so my career started with joining Kaiser Permanente, and I was on the administration track. I was the chairman of the department for several years. But then the dot-com boom happened. So I took a year sabbatical to understand what's happening. So I joined a startup, and it was very exciting. And I learned a lot about technology. And so when I came back from that sabbatical, I started a research network to be able to take the data from the electronic health record and analyze it and give it back to the physicians in a way that is digestible, understandable, and actionable. So they were able to make some great decisions. So that's called a clinical decision support tool that we built, and that has been very popular. That's how I got into technology.
Well, I'm going to get into the decision support tool because in a lot of the research that I do, and quite recently we published a report with Elsevier on the future role of the clinician. And throughout those interviews, clinicians told me that the number one thing they want is decision support tools. They want all the knowledge that is vested within these systems to support them to make the right decision at the right time. So I really want to get into that one with you. Just before we do, I mean, what is it? What did you see as the potential of technology? Like that sabbatical, going away, coming back. What was it about tech that you thought, yeah, I really want to focus on this. I want to do something practical with this.
So when you think about all the knowledge or say data that is being collected in the electronic health record, that is just sitting there, and there are some really good nuggets that are in there that we need to extract, and that's where machine learning and artificial intelligence comes in, and that is what is very fascinating for me. I mean, if you think about a physician's job, maybe they'll see 1,000 patients of a certain kind, that will stay in their memory. Even that is, doubtful that they can remember those patterns, right? Imagine doing that with 100,000 patients of similar kind, and you extract, the knowledge from that experience, and machines can do that. And you can just keep expanding. You can expand to millions of patients that are similar, and that can give you the knowledge to be able to do the right thing for those patients at that particular moment, as they encounter physicians in the emergency department. And that is fascinating to me.
Yeah, that's the opportunity, right? You see it. You like taking all the knowledge and data that we have, and even and making something of it over time and through trends and stuff. So the decision support tool, which you have introduced, and it's now, correct me if I'm wrong, in like 21 hospitals and has over 1 million users. Is that right?
That's right. It's available in 21 hospitals in Northern California, and about 1 million patients go through the system every year, which means that every single patient could potentially benefit from a system like that, where the physicians get this knowledge from, say, 100,000 patients that came before them. So you are actually looking at real world data and then making decisions on the next patient that you see. So it is a fascinating system.
And the other beauty and challenge of data is, I think if you get it right, and if you you learn over time what data inputs are really working, what adjustments need to be made, improvements over time, and that means that overall the algorithm can get better. And one hopes over time become more accurate, and hope over time becomes inclusive, which is another big topic within the industry right now. So tell us about that. I mean, you must have seen from the first year of
Yes.
implementation to now. Give a sense of some of the things that you've seen happen with that in that time.
Yes. So what we did initially was, we collected about let's say, for example, chest pain, right? Chest pain is a very common condition that people come to the emergency department. In fact, it is one of the top three conditions that comes to the emergency department. And when a emergency physician sees chest pain, the first thing on his mind or her mind is this a heart attack, right? And so, how aggressive should I be uh, in terms of, you know, running tests or treating? Um, if it's an obvious heart attack, it's easy, right? You know what to do. But what about the patients that could potentially have a heart attack in the next 1 week, right? If you catch them early, then it's great, because then you can intervene and prevent a heart attack from happening. But also, you think about thousands of patients that don't need to get all those tests done, all that aggressive treatment done, or being in the hospital, just to observe. So what we did was we looked at, let's say, 100,000 patients that came before, and we looked at all the characteristics of these patients that actually make them higher risk or lower risk. So we looked at 30 plus variables on these patients, for example, age, past history, and procedures, lab tests, medications that they take, everything about that patient, and then uh, and decide which risk category do they fall under. So once you know, based on these variables, which risk category they fall under, and you can compare that to the current patient. Where does this current patient that I'm seeing right now fall in that spectrum? And once you know that, the answer is given to the physician saying that, hey, this person you're seeing in room 23, um, the chances of this person having a heart attack in the next 7 days is 0.003%, which is very low. And so you should do A, B, and C. Or you don't have to admit the patient. You don't have to watch the patient, and things like that. Very instructive suggestions to the physician. And the physician has an option whether to do it or not, right? They can use their own judgment. But having that knowledge at the back of their mind helps them make the right decision for the patient. And maybe the patient is high risk, and the physician doesn't realize that. So it'll alert the physician, hey, this person is high risk. And so you need to observe the patient in the emergency, repeat the test, or get a cardiology consultation on this patient. So those are the subtle kind of things that a physician might miss but the
Mm.
machine picks up. And so that helps them streamline the care, provide the appropriate care, and not miss any major, problem patients that patients can run into, problem areas that patients can run into
Mm.
in the future. So you're kind of predicting what's going to happen to the patient, and that helps a lot for the physician.
It makes absolute sense, makes absolute sense. And that's why one hopes that that is just going to become standard of care. That's what we aspire for, right?
And yeah, and patients love it because they don't have to stay in the emergency department or stay in the hospital unnecessarily waiting for tests to be done.
Mm.
And it's also good use of resources because there may be another patient that is at higher risk that needs that hospital bed, but you have a lower risk patient sitting there. So it's win-win-win situation.
Absolutely. Yeah. The efficiency is a time cost. Convenience and kind of satisfaction is another driver there. You can see that. And ultimately, we're making better decisions, one hopes. Before we move ahead to the next area, which I want to focus on with you, I just want to talk about implementation and just so many great ideas stop at the door. So, briefly, could you just describe what was the attitude to rolling out something like this, and any learnings that you can share for others?
Yeah, I mean, something like this, it's a major, major undertaking. I mean, especially in 2010, it was very new. The organizations, they don't know that something like this can be done and actually, make a difference. So initially, obviously there was a lot of skepticism. Oh, that is too futuristic. That you can't do that with the current systems. Uh, but the technology itself, it's fairly simple. If Google can do that, if Netflix can do that, why not healthcare systems? Right? It's just a matter of getting the right technology in the right hands and designing it the right way. And that means that physicians need to be involved in the design and the implementation process of it. And that's where I feel that the physician's voice is important, and that's
Mm.
when organizations will take notice. Of course, it's not easy to implement something like this. You need a full system of education, research, technology implementation, and then evaluation. Right? You have to closely monitor these things so that you're catching any problems early on. And so it's a full system of implementation that we had to do. Obviously, it took us, I would say, 18 months to get the approvals, even though we had the funding. Obviously, healthcare is a tough business. It's risky, right? So you have to be careful, and so you have
Mm.
to make sure you check all the boxes, and you have all the systems and backups and everything ready. And we do this under a research umbrella so that you get consent and everything, goes well with the system. And then you start it slowly. You start with a pilot, and slowly try to build on top of it, and then you get into the cycle. You plan it, you do it, and you check, and then repeat. What Take the learnings and then put it back into the system. It's a continuous process, and it takes a lot of work, and
Yeah.
experts and people.
Yeah, I mean, early buy-in is so key, and I think that's something that you've demonstrated. Senior level buy-in, of course, but then clinician buy-in too, right? And time again, I hear from clinicians, various specialties, telling me that, well, they're just pushing something on me, or there's this new system, and all they're hearing is I have to learn a new system. They've not been involved, they've not been a part of it, and I know that's not easy, and it depends on the institution, but I do feel like that's a huge area that you are advocating for, and part of that is you bringing clinicians forward through Innovator MD. So I want you to share more about. I mean, how did Innovator MD come about? Please tell people what it is too.
Sure.
And yeah, I want to get into the role that you're playing in helping clinicians have their voice heard.
So you made a very good point about being pushed on physicians, right? Things are being pushed on physicians. What if the physicians actually create those systems? They understand physicians' thinking, they understand the problems that they are facing in their practice, right? And if they come up with the solutions, those solutions are much better accepted by other physicians, by the rest of the system. Now, if you think about, physicians are, at the top of their knowledge, right, and skills in a healthcare system. But generally what happens is, you're using physicians as just frontline workers. um, y- y- Physicians are great because they have a lot of knowledge, a lot of skills. They spent years focusing on a particular specialty, and so they have a lot of experience. But if you're using them just for the front end jobs, what you're missing is that the solutions that they can come up can help the whole system do better. And that's where, when I got out of Kaiser, I was thinking about how can we help these physicians who are coming up with ideas and solutions to the problems that they see firsthand. How do you help them learn how to do innovation? How do you help them expand their idea? How do you help them bring support to those ideas? And the good ideas could actually be a commercial product, where, or a company, a startup, where, you can build and expand and bring visibility to those solutions. And that was the idea behind Innovator MD. And I started Innovator MD about 3.5 years ago to actually teach and inspire physicians to innovate, and also help them, bring ideas to the market, where they become a commercial entity. How do you get investments? How do you get co-founders? How do you build the technology, and how do you market it and get customers? And so I created this entity, Innovator MD. It's my it's a community of physicians and other supporters of physician innovation coming together as an ecosystem for startups. That's what we do.
Oh, that's brilliant. I love it. You saw a gap and you were like, let's do something about it. Yuli, is it global? Can clinicians from different
Yes.
countries join?
Yes, it's global.
Fantastic. And you've an event coming up as well, right? We should let people know that we'll put the link into the chat for those watching now and on demand, but go to innovatormd.com and there's lots of information available. And that event
Yeah,
looks like a fantastic lineup.
yeah, it's coming up in August 17th through 20th. It is Innovator MD World Congress 2022. And you can see some amazing innovations that physicians are doing. And so this is a platform for them to showcase those innovations and talk about them, and network with other physicians who are doing interesting things. Of course, the other half of it is the support system, right? The
Yeah.
technologists, the business people, the investors, and of course we have students too that are interested in this area. So it's a very exciting, very different kind of conference, not usual boring conferences. This is every every 10 minutes there's a new topic and a new idea, and so you'll get blown away.
Nice. Yeah, great. Content is king, right? I've gone to so many conferences lately and I was like, that's it. Show me something new. So yeah, I'm very excited to be attending and coming to Innovator MD. But going into
Yeah.
the clinicians, I see that you have an infrastructure around them. You're helping kind of crystallize their ideas, introduce them to the right individuals. Evidence is really, really important. Um, and we get there's a lot of challenge where things just people are like, yeah, that's a good idea, but prove it. Then the cost to prove it is huge. They really the standard now is randomized control trials against what currently is standard of care, and those things are not easy to do or navigate. So, how do you tackle? I mean, just from your perspective and experience, but also from Innovator MD, how do we tackle evidence and generating evidence?
So, involving physicians in the innovation process, there are two big advantages. Number one, they can check the science. What is the science behind this innovation? Is it real? Does it work? And so you don't get this pseudoscience type of innovations into the market, number one. Number two, a physician will tell whether it's going to work or not. They're very practical people. And so, am I going to use this in my practice or not? Let's say a dermatologist came up with a solution. And then if 10 other dermatologists say, "This is great, I'm going to use it in my practice." There you go. Is it going to work or not? You will know immediately. Number two, if it is not a scientific solution, if the science doesn't work, they will tell you immediately, that's not good science. And so we can check off things very fast, very quickly when physicians are involved, and that's what I want to bring, to the community, is that if you have an idea, and if it is a real good idea, and you will get immediate feedback about that. If it's not a good idea, also you'll get immediate feedback, and so that you can move on to your next idea. And that's where I think it, that's what is needed to be able to test that. Now, the question about evidence generation, physicians are so well versed about evidence, right? Research. They understand research. When somebody does a clinical trial and they say this drug works or this device works, they know that. They also know that just because there's a clinical trial does not mean that it's going to work in the real world. And so they have much more real world experience. And now that we have so much digital health technology and the electronic health record, so we are collecting a lot of data. And we can actually go back and look at our data, look at the outcomes, and see if it is working or not. And very quickly, you can tell whether it's going to fly or not. And that's how the evidence
Mm,
generation is changing. Although you have to do a clinical trial to get the FDA approval or whatever you need to do for the regulatory reasons, but
mm,
real world data, real world evidence, it becomes much more important. And that's where we are investing in also, as far as what's going to be in the future. There may be a drug that costs $100,000 a year, but how do you know that it works, and
mm,
which specific patient it's going to work in? A clinical trial will not tell you that.
yeah.
A real world evidence will tell you that very quickly.
Mm. Very well
And so,
put.
yeah, we are building that capacity through our innovations.
Fantastic. I mean, you see so much, right? In your role, you get to explore and work with different specialties and different tech. I want us to move on to your particular new area that you're focusing in on, and the new company that you've developed, which is really focused in on autism. So tell us more about the new company and specifically why this is important to you, and why did it peak for you to decide to go down looking at this as a new company?
Yeah, so this is my passion project, and also that's my mission, mainly because I'm personally affected by autism. I have a daughter that has autism, and so, I know the challenges firsthand. And as a physician and researcher and a technologist, I understand, uh, there could be some solutions, and I've been looking for that for a while. And when I found it, that's when I thought, okay, I'm going to take the solution and apply it to autism. And that's how Circa Therapeutics came into being. You must have seen a video on YouTube about our prototype. I'm so excited about it when my daughter tried it and she loved it. So what it is it's a robotic system that is connected to a virtual reality video game. It sounds very futuristic, but it's very simple. What you're doing is you're taking the patient and placing them in a deeply immersive environment, and they are being challenged physically and mentally. We think that the hypothesis is that when you put patients in those kinds of situations, you are triggering new neural pathways. And so you are also encouraging neuroplasticity, which we think will help the symptoms. And that's the hypothesis we are working on. We're actually ready to do some pilot studies in the next few months. And so this is very exciting for us. You can see I guess you can put the video in the show notes.
Yeah, absolutely. So click the link below. The video that Yuli just referred to is available there, and it's fantastic to see the reaction and the engagement. And what I found fascinating when we spoke is on one is the origins of autism are unclear. As a father, you were researching and trying to understand it, which is what kind of led you down the path of looking into technology for it. But also, the current support mechanisms are really, can average out to like 30 hours a week of
Yeah.
support. And that's if you get access to the support. So let's just start on that. Some people don't even get that. And optimally, you're looking at 30 hours of support. So when you have an area like this, and I mean, I think you can talk more eloquently about it, but this is an area which, as a development disability, is only going to grow. The projections are that we're going to see more and more children who have autism. We do not have enough, individuals and therapists to optimally support them. So what you're doing
Exactly.
really is so necessary, and you're meeting them where they are, which is the beauty of tech. A smartphone first generation who understand and want to use immersive tech, who want to use engaged ways, who want to use short, easy ways to absorb information. So talk to us a little bit about that, kind of the
Sure.
need, the need
Yeah.
for it.
So if you think about autism, it's a very interesting condition, and we know very little about it. Um, 2% of the population is affected by it. Every There is one person born with autism for every 44 births, and that ratio keeps increasing. That means the incidence and the prevalence is increasing, and nobody knows why. It grows by about 10% every year, and it has become the fastest growing um, neurodegenerative or neuro developmental disorder in childhood. And so imagine all these people will live a full lifespan. There's no decrease in lifespan, which means that all these people will need services and care and all these things throughout their life. And one of the big problems that happens is with autism is that as they grow older, um, it is harder to manage the patients because they become more aggressive. Socially, it's awkward. They cannot function on their own in the community, and so they need a lot of support. Initially when they're growing up, they need 30 to 40 hours of therapy, one-on-one, what we call ABA therapy, applied behavior analysis, which is pretty intensive. Right now, there are only about 30,000 therapists available in the market. So we need about 60,000. And so, how do you bring these services? One of the solutions the solution that I'm working on is a machine where it'll hopefully decrease the need for therapists, but also be an adjunct to a therapist's work. And hopefully, in the future, it can be home based and can be operated remotely so that the machine is in the patient's home and they can use it at home, and the therapist can be remotely working on several patients at a time. And so, trying to increase their availability and access to this kind of a treatment would be amazing. That's what we're working on.
More power to you. Yeah, solutions that give scale, that give one to many. I mean, behavioral health and neurological diseases are where majority of investment is right now, and thinking about more personalized solutions, non-pill based solutions, education
Exactly.
platforms absolutely are needed. And I can certainly see where the future signals are for that. We need investors to be focusing on this space.
Yes. By the
Um,
way, we are raising our first round.
well, there you go.
Circa Therapeutics is raising our first round. So if anybody's interested, I'd love to talk with you.
Absolutely. Well, I encourage people to. I mean, with your experience and background, I have no doubt where this is going, and that you'll make some incredible changes and differences for the future of individuals who have autism. And beyond that, Yuli, thank you so much for sharing your experience with us. Reminders to people that Innovator MD is available to you as a clinician, then get engaged and get involved in the program, whatever stage of career that you're in. There's lots of links and things that we will send, but we knew 30 minutes was not going to be enough. I still have so many questions, so we will be doing another chat again soon. Yuli,
Yes.
it's been so wonderful to talk to you. I wish you all the best with the upcoming pilot work that you're doing for the new solution, and I will look forward to meeting you in person. And beyond that, I encourage everybody click and subscribe to Reach Live, connect with thought leaders like Yuli, and be part of the movement to change things and see new things happen. Thank you very much. See you next month with another thought leader, another innovator. Have a wonderful weekend. Thank you so much for listening to Reach Live. See you soon.